Thank you. And so I'm Chris Nelson. I'm a psychologist. I'm at Sloan Kettering Cancer Center. And talk about which patients choose implants, but maybe more importantly, who's satisfied and who's not satisfied. And are there things we can learn from those who are not satisfied to help us with our treatment? There we go. So I have no financial disclosures related to this talk. I do have a thank you to Dr. Landon Traust. I borrowed a few of his slides for this presentation. And so here's what I hear about implants. So I'm a psychologist. Patients come in and talk to me about should they have implants, should they not? And here's what they read, and here's what they hear, and here's what they tell me. So first of all, every man is satisfied with an implant. It's going to be fantastic, right? You're going to be rock hard like you're 18 again, right? And all wives and all partners love it. And of course, so we know penile prosthesis is associated with excellent long-term outcomes. And historically, the satisfaction rates are about 90% plus, and you hear satisfaction rates of 94%, 96% satisfied with an implant. And ultimately, the question is, are patients and partners really that satisfied? Because there are implications in assuming very high satisfaction rates, implications such as maybe moving too quickly to present implant as an option, poor or incomplete pre-surgical information or counseling, poor or incomplete follow-up post-surgical counseling, and then setting unrealistic expectations. And so if you take a look at the methodology of the literature that reports satisfaction, so this was a review in 2020. It reviewed manuscripts from 2009 to 2019. Primary conclusions were low methodological quality evidence on outcomes, right? So most satisfaction databases primarily on things like surgeon assessment of patients, right? We know that there's high bias there. Non-validated questionnaires, moderate to high bias. And then modify existing questionnaires such as the EDITS or the SEER to assess outcomes. And so in defense of those authors who've done that, kind of at this time, there weren't any really very good patient-reported outcomes on satisfaction after implant. And so that's probably the best that they can do, but still cause limitations in the literature. Also, erectile function was measured, but not things like device function, concealability, or naturalness. And so to help improve the quality of the literature, I want to just point out one recently developed patient-reported outcome. This was from our group, and in the development of the patient-reported outcome, we started with the literature, a complete and thorough literature review, and the research team, guided by the literature, outlined specific domains, developed questions, and then we sent that to 6 experts in the field. We received their feedback. From their feedback, we developed a draft questionnaire. Once we had that draft questionnaire, we gave it to 12 patients called cognitive interviewing, which received feedback on things like the domains, the questions, were the questions worded correctly, should we change some of those questions, response format, the length of the questionnaire. And then we modified and winnowed questions into what was close to the final questionnaire, and then we did the psychometric validation with 118 patients, validated with things like the IAF, the EDITS, and the SEER, and provided strong psychometric support. And so what we were left with and how it was developed is validated in English, 16 items, 5-point Likert scale, and assesses 4 domains of satisfaction. So pain, appearance, function, and overall satisfaction. And we believe this is strong methodological development to help move this literature forward in terms of satisfaction with implant. And so here are some of the initial results from this validation study, 118 patients. And you can see from the SIPI, which is the name that we call it, shows high mean satisfaction scores for sure, and overall satisfaction. This score in pain means there's satisfaction with less pain, not more pain, appearance and function. But I just want to point out percentage of patients indicating somewhat to very satisfied. Overall satisfaction here is 76%. So still very satisfied, right? Good quality outcomes, but 76% satisfied is much different than 96% satisfied and probably sets up a different conversation when we're discussing implants. And so why all the focus on satisfaction, and why is this so important? Because expectations are important. As you set potentially unrealistic expectations that everyone's going to be satisfied, that it's going to be fantastic, you're setting up disappointment after the procedure and dissatisfaction with patients. And we know that patient dissatisfaction, right, often means physician dissatisfaction, right? They're going to come in and they're going to tell you about their dissatisfaction, which causes you dissatisfaction. And so what can we learn from these patients who are dissatisfied? And so place to go is the literature from the litigious patients, that is, who are filing lawsuits related to IPP placements, and what can we learn about some of those outcomes. And so in this review, 2014, presented legal database cases from medical malpractice cases involving penile implants from January 1990 to December 2013. So results, 40 cases. So 58% of those cases found in favor of the dependent, but 42 actually led to payoff to the plaintiff. And main issues involving malpractice litigations were surgical performance, but also things like informed consent, and those issues in pre-surgical counseling and then post-surgical management. Physician factors related among lawsuits where poor physician relationship was a contributing factor. So physicians appearing rushed and uninterested, failing to return messages, and here's this unrealistic treatment expectation set up before treatment, and condescending physician and rude physician. And so highlights the importance of the physician-patient relationship. So also highlights the importance of preoperative counseling, assessment, and good patient selection. And what are the things that we can do to help think about this counseling and then patient selection? So we know preoperative counseling, we know it's informed consent and also managing expectations. In this study, 2010, showed an inverse correlation between preoperative expectations and postoperative satisfaction. So the higher the expectations preoperatively, the lower the satisfaction. And interestingly, 24% of the satisfaction of the implant was related to expectation management. So 24% not related to any skill as you as a surgeon, but 24% related to expectation management. So expectation management should focus on things like realistic penile length, penile sensation, partner satisfaction, and of course engaging the partner can also help mitigate post-IPP challenges and partner expectations. This is an interesting study of 58 men with pursuing ED for implant surgery. So patients underwent a relatively well-done psych evaluation and completed patient-reported outcomes, personality characteristics, and mood. And 28 of those were assessed to be unfit for surgery. And if you're thinking about patient selection, things like anxiety and depression, neuroticism, unrealistic expectations, inadequate social functioning, and unstable partnership. Important considerations when you're thinking about, again, patient selection. This is a study, this is actually a report done by Landon, a really nice review looking at urologic and non-urologic cosmetic surgery, and then what led to dissatisfaction in those surgeries. Landon came up with the cursed patient, but things like compulsive obsessive behavior, so someone who's inflexible or overly detail-oriented, you might want to flag as someone potentially who will be dissatisfied after the procedure. Unrealistic, kind of optimistic, discount possible complications. Revision, dissatisfaction with prior outcomes, right? Surgeon shopping, those who are shopping around looking at numerous consults. Those who are entitled, disrespecting, patronizing, demanding special attention. Those who are potentially in denial related to what they were before they came to visit you in terms of exaggerated memories of penile length or penile girth. And then, of course, psychiatric psychological disorders such as mood disorders, borderline, and penile dysmorphic disorder. And so in conclusion, so implant satisfaction rates may be overstated. Important to use validated measures to assess this. I talked about the SIPI in English. There is one also in Italian. May lead to unrealistic expectations with the implant. Drives patient dissatisfaction, which of course can drive physician dissatisfaction. Increased chance of litigation, potentially, for those who are dissatisfied. Importance of good preoperative counseling and patient selection. And I encourage you to look up the manuscript by Landon, The Cursed Patient, give you a good assessment or good guidance in terms of patient selection. Thank you for your time.